Welcome to Trump's America. Today we're exploring the vision and policies of Robert F. Kennedy Jr. as they relate to leading the Department of Health and Human Services. Known for his distinctive approach to public health and commitment to transparency, RFK Jr. has sparked widespread discussion with his ideas for reforming healthcare systems, improving agency accountability, and prioritizing the well-being of all Americans. In this video, we'll take a general overview of his overarching principles, what drives his vision for HHS, and how his leadership could reshape the nation's health policies. Robert F. Kennedy Jr.'s policies for the Department of Health and Human Services focus on several key areas, reflecting his broader Make America Healthy Again platform. Let's dive in. Reform of vaccine policy. Kennedy has expressed skepticism about vaccines, particularly regarding their safety and efficacy. He has advocated for revisiting federal vaccine recommendations, which could mean changes in how vaccines are regulated, approved, and recommended. However, any direct ban on vaccines would face significant legal and constitutional challenges, as states hold primary authority over public health decisions like school vaccine mandates. Influence on advisory committees. As HHS Secretary, he could potentially influence or recompose advisory committees related to vaccines at the FDA and CDC, which could lead to more vaccine-skeptical recommendations. Food policy overhaul. Kennedy aims to crack down on food additives, ultra-processed foods, and pesticides, linking them to the rise in chronic diseases. His proposals include making school lunches healthier and potentially altering regulations on food safety and chemicals. However, his exact strategies for implementing these changes at HHS are less clear, as much of the oversight for these areas also falls under the EPA and USDA. Raw milk advocacy. He has expressed support for raw milk consumption, arguing against pasteurization, which could influence food safety guidelines and public health messaging. Tackling chronic diseases. Kennedy's agenda includes reducing chronic illnesses by addressing environmental and dietary factors. His approach would involve restructuring federal health agencies to focus more on prevention and holistic health approaches. Agency restructuring. He has mentioned firing or reassigning staff at agencies like the FDA, NIH, and CDC to reduce what he perceives as corporate corruption. This could translate into significant changes in how these agencies operate, staff, and prioritize health initiatives. Abortion and reproductive health. His policies could potentially undo some of the liberalizations in abortion access made under previous administrations, like expanding protections for healthcare providers who object to performing abortions and potentially limiting access to medication abortion through FDA regulations. Healthcare system. Kennedy has criticized the pharmaceutical industry for profiteering and has proposed measures to control drug prices, possibly aligning them with European standards. He also advocates for shifting research funding towards more natural, holistic, and alternative treatments. While his views on broader health policy like the Affordable Care Act or Medicare remain somewhat unclear, his approach might involve increasing transparency or altering how these programs are managed to align with his health reform vision. General policy implementation. Kennedy has indicated a willingness to significantly alter the personnel within HHS agencies to align with his vision, suggesting a culture shift towards more skepticism of established medical consensus in favor of alternative health perspectives. Kennedy's appointment would likely be contentious, given his history of vaccine skepticism and other controversial stances, potentially facing significant scrutiny during Senate confirmation hearings. His policies would be shaped by his ability to navigate the complexities of federal health administration, legal boundaries, and the established scientific consensus within these agencies. In our upcoming video series, we'll take a deep dive into each reform agenda. Be sure to subscribe and turn on notifications so you don't miss out.